we have a question that's come in from Annie. And, oh, wait, no, from Joe from YouTube. How do Medicaid cuts affect those of us on Medicare? Okay, well, this is one of the more complicated questions that you could ask, because there is a provision in the law that says if significant deficits are created, those deficits will be remedied through a provision that would cut essentially programs across the board, but Medicare is limited to 4%. But we could be looking, as a result of the big, beautiful, not so beautiful, very ugly bill, we call it the big, beautiful betrayal bill, because the bill essentially throws families under the bus. It proceeds to say, hey, we're going to take health care from 16 million people to fund tax giveaways to the richest Americans. We're going to cut food programs, meaning about 4 million children will go hungry, to fund tax giveaways to billionaires. You add it all up, and this entire Republican big, beautiful betrayal of families bill proceeds to result in so much deficit that it could well produce a 4% cut in Medicare. And exactly how that cut would be applied and which aspects of Medicare, all that would have to be figured out. But just recognize there is a connection. This bill is doing devastating effect to Medicaid, which has a different name in every state. In my home state of Oregon, it's the Oregon Health Plan. But the bill as a whole can also result in a significant cut to Medicare. And now we're going to go to Colin Berry's question. And he is asking, what will the people on Medicaid be expected to do? Are there any alternative health insurance plans people can look into? And Colin mentions this is such a disaster. Yes, it is. So if we think about the very divided structure of healthcare in America, we have Medicare, which is generally folks who are 65 or older. We have private health insurance. We have some companies that are self-insured. We have the Children's Health Insurance Plan called CHIP. We have a separate healthcare system for veterans. And we have Medicaid. And Medicaid began as a program for the least affluent among us, that they'd be able to have healthcare. Well, it also now does long-term care for seniors. It provides support for those with disabilities. A lot of veterans get their health care actually through support through Medicaid. It is a key provider of funding for our rural hospitals and our rural healthcare clinics. But so here we are in that entire situation. And so there's many different people receiving help through different aspects of Medicaid. But let me talk about just your general family that's less affluent, that has Medicaid, and the state says, well, they've made it very, very hard for people to sign up. They've wrapped the application process in red tape. They've made it more expensive for states, and states don't have the money to be able to keep as expensive programs. So you get a message saying, sorry, but we're shutting this down. What are you supposed to do? So that's why Colin's question is so important. And the answer is, you're in trouble. The estimates are now that this bill will cause 50,000 more deaths a year. Why is that? Well, so you have diabetes, but you don't have health insurance, and so you can't manage that diabetes, and it causes more trouble. Or you have congestive heart failure, but you don't go in and get help. You have a cancer that could have been stopped in the early stages, but it grows. And you know, this is very personal to me, because back when I was the director of Habitat for Humanity, I hired a construction manager, and in the first week on work, he had an artery burst in his throat because he had cancer in his throat, but he hadn't got it treated because he didn't have health insurance. And he's leaning over a sink, blood pouring from his mouth and his nose, and I'm like grabbing him, holding him up and saying, this is not a nosebleed, I gotta get you to the hospital. And he says, no, he's shaking his head no. And finally I said, I'm sure this is so much greater than anything ordinary. And I hear the words, no health insurance. So of course, immediately I called the ambulance and they saved his life. But it was a very close call. So it's a disaster. And what happens generally when people don't have health insurance, they either don't get health care or they can't afford the drugs that they're supposed to be taking to manage a condition. They often end up in the emergency room, but there is no magical solution if we allow Medicaid to be eviscerated. So let's not allow that to happen. That's why we need to put a knife through the heart of this bill and then put it in the deepest part of the ocean so it can never resurface. Amy from YouTube says, how will you educate Republican senators who say they oppose Medicaid cuts but support work reporting requirements, which cut millions who work or are exempt? So the whole change in how you sign up for Medicaid is designed to make it extremely difficult. Think of about a doorway, which then you take red tape and you crisscross it, the door with so much red tape, nobody can get through the doorway. That's what they're trying to do. Now, it's not a strategy to say, hey, we think that this will encourage people to work, because we already know that people try to work. They want to be more affluent than they are, and they want to have income and the benefits that go with working. We've already had an example in Georgia where this red tape was applied to expanded Medicaid. And you know how many people got signed up in a state the size of Georgia, where maybe 100,000 might have been eligible or more? Like 4,500 people, just a few thousand. It was a complete failure, because what happens if you don't have health care? Well, the answer is you can't get well enough to work. And so it does the opposite of what they say. And plus, they're saying you have to reapply every 6 months. And I was just told today that in some cases, you'd have to reapply every month. Are you kidding me? Picture the mother who's working 2 part-time jobs where the schedule's always conflicting, and she's trying to get home so that she doesn't have kids or getting back to the house after school without her there. And in the process of all of that, she's supposed to reapply continuously and track that. No, this is absolutely the opposite. Please tell the Republicans, are you really the party that wants to cut red tape? Then why are you voting for this bill, deliberately creating massive red tape for folks who are already pressed against the wall? It's not as if they have special assistants like the rich have, who can spend days on the phone and days looking up the right forms and days visiting offices to get signed up. No, it's people who don't have that type of space because they are pressed against the wall. So tell our Republican colleagues, if you're really against red tape, the folks who should most benefit from cutting red tape would be those who are less affluent, and you're doing the opposite. What you're doing is wrong. What you're doing is cruel. We know what you're up to. You're not about supporting work, because we already have the experiment in Georgia. We know that doesn't work. This is about preventing desperate people from being able to keep health insurance, and they won't have it when they need it. And now we have an individual from Instagram who's saying, what's being done to protect PBS and NPR? Well, so in the bill, they have inserted policy provisions. And those policy provisions come out if they don't, are they primarily about policy or primarily about the budget? If they're primarily about the budget, about revenue and spending, they can stay in. They're primarily about policy, they have to come out. That's the Byrd rule, named after Robert Byrd of West Virginia, because reconciliation was a special fast track to consider initially, and for 22 years, this is what it did, could only be used to lower the deficit. And then the Republicans proceeded in 1996, 22 years later, to do a nuclear option, in which they said, hey, we want this filibuster-free pathway not to reduce the deficit, but to increase it. And because they wanted to do tax cuts for the richest Americans. So they blew up the fiscally responsible, 100 senators voted for it, 1974 bill, and repurposed it to increase the deficit and the debt, therefore, by giving tax breaks to the richest Americans. So the question that is going to be wrestled with on the Senate side, because this doesn't apply in the House of Representatives, is this provision about defunding PBS and National Public Radio, public broadcasting, is it primarily about policy because folks don't believe that we should have a publicly funded media? Or is it primarily about saving the money that we currently invest? Well, we're certainly going to be making the argument. It's primarily about policy, and it needs to come out. So we'll make that effort. If we can get it out, great. If we don't get it out, and it's a balancing test in the hands of the parliamentarian, well, then we have to tear down the whole bill for all the other reasons we're tearing down the whole bill, all the other reasons we're trying to put a stake through the heart of this bill or a knife into the heart of this bill, because that's the way we will protect PBS and NPR. It has been a pleasure to be with you. Thank you all for being engaged and taking on this big, beautiful betrayal. With your help, pressing from the outside, advocates inside the building, those of us who are in the Senate fighting for working Americans, who understand this is a families lose, billionaires win bill, we're carrying the fight, but the real effectiveness is when there's an inside force and an outside force, like all of you. So give your Republican House members and your Republican senators a hard time about them creating red tape on the poorest Americans. Give them a hard time about funding tax benefits for the richest Americans by leaving millions of children hungry. Give them a hard time about stripping health care from 16 million individuals. It's a lot of families, a lot of people, recognizing that not only will people suffer more from the disease, from an inability to afford their meds, inability to go to the doctor for medical treatments, but an estimated 50,000 a year will die because of those increased healthcare conditions. So this is a life and death issue. It's healthcare should be a right, not a privilege of being affluent.